Hello everybody, I am Dr. Vandana Agarwal, Emergency Physician, Kim Sunshine Hospital. Today we are going to discuss about do's and don'ts of medical emergencies. Together we can save life. A few steps which is done by you guys before getting the patient to the emergency department can help us a lot in treatment, can reduce the morbidity and mortality of the patient. So let's begin. The first and the most common emergency which we see is chest pain. Chest pain in the center of the chest which is radiating to the left hand, it could be a heart attack. What are we supposed to do in that scenario? Just one dose of aspirin, 300 mg can be taken orally. What we are not supposed to do is, please don't give sorbitrate sublingually. That can cause hypotension, which can add to the injury to the patient. Second common emergency that we see is seizures. What are seizures? Fits. When a patient is fitting, just turn the patient to the left lateral position, which we call it as universal recovery position. That is to avoid aspiration. What we are not supposed to do is don't insert anything orally or put in the hands. Third important thing is stroke. Stroke. What are we supposed to do when there is a stroke? Stroke is nothing but paralysis. Most important thing is to identify that the patient is having a stroke. What are the points to identify? If a patient is having imbalance, difficulty in vision, facial drooping, arm drifting or any kind of a slurred speech, get the victim to the emergency room immediately within the first 60 minutes, which is called as the golden hour. What we are not supposed to do is, don't delay. Shift the patient to the stroke ready hospital ASAP. Fourth important medical emergency is nasal bleed or nosebleed, which we see commonly. What are you supposed to do? Just make the person sit upright or lean slightly forward. You can even pinch the ala or the tip of the nose like this. Even ice helps in reduction of the or reducing the bleeding. What you are not supposed to do? Don't lean back, no patting on the head, no bending backwards. That can cause an aspiration again. That would be harmful. Fifth important thing is cuts or wounds. Whenever we are working in the kitchen or any other place, we tend to have small cuts. What are we doing? We have to run the cut under the running distilled water or running tap water for minimum 20 to 30 minutes. After that, gentle application of a sterile cloth can help in reduction of the bleeding. Get the patient to the nearest emergency room. What you are not supposed to do? Don't apply any kind of paste, ghee, butter or anything over the injury or the bleeding spot. So the next medical emergency is burns. Burns could be flames, burns could be because of crackers, burns could be because of the boiling water or boiling milk, tea, anything. Any burn area should run under the running tap water for minimum 20 to 30 minutes. After that, get the patient to the nearest emergency room. What you are not supposed to do is same thing. Please don't apply any paste, don't apply any ghee, water, turmeric or anything else over the burn area. Next important medical emergency is snake bite. Before going for do's for the snake bite, I would like to tell you about the don'ts. What are the few don'ts? Don't be a vampire. Don't suck the venom or the blood, which we see in the Bollywood reels. Please don't tie the cloth around the wound. What you are supposed to do is just immobilize the limb. Keep the limb below the level of the heart. If the person is wearing any constricting bands or jewelry, remove that and get the patient. Stay healthy, be happy, take care.